They are the unsung heroes, the silent frontline workers. But their role is perhaps one of the most crucial when it comes to fighting COVID-19. Well, the outbreak of coronavirus in Kenya 9 months ago underscored the massive role played by paramedics. The courageous men and women offering medical rescue often perform complex, life-saving functions in extremely stressful crisis situations. Tonight, in our Events 2020, Elphas Lagat files a report on how paramedics must stay grounded and maintain authority in situations where a mistake can mean the difference between life and death. Take a listen.
When the siren goes off, it is a signal, a red alert that there is a potential emergency that requires swift action to save a life. It is a matter of life and death. A race against time in which any delay can be fatal. E-Plus Emergency Services is a flurry of activities.
Worry, your patient will be in good hands. We have a nurse on board who will be taking care of the patient. Yes. Where do you want your patient to be taken to?
Roger, otherwise your 10-3. Your 10-3 is figures 1731. 1731. Confirm COVID?
This is Mombasa, right?
There is a 10-2. There is a 10-2 Southlands Langata.
Emergency calls from all corners of the country coming in one after another. Paramedics working at the dispatch center have never been this busy.
Kwa siku unaweza pokea simu hata zaidi ya tunaweza pokea kwa mamia kwa sababu kila mara unaongea na huyu ikikatika ingine inaingia, so kwa siku tunaweza ongea na over 100.
The coronavirus pandemic was unprecedented. These emergency services experts were not ready, at least not for this magnitude of a pandemic. The fear, the uncertainty, the stigma associated with the novel coronavirus was palpable when Kenya started reporting positive cases. 9 months working with suspected COVID-19 cases and confirmed ones have been unnerving even for the trained paramedics.
Kesi ya kwanza nilishtuka, sijaifanya 19.
Initially, it was fairly a bit frustrating and scary in the same place, because in the sense that this was a new disease that was here with us, and
none of the staff had the confidence and the courage, and they felt, I am going to go into a death trap.
It has taken dedicated, constant training to help assure the paramedics of their safety. Donning and doffing particularly has to be done correctly, as a mistake can easily lead to contraction of the virus.
Again, it's just not about having the PPEs, but having the right PPEs, training them how to don and doff these PPEs, because you might be having the PPE, but you are not protected. So chances of the virus penetrating into your system is very high.
Now stretching into its 9th month, the coronavirus pandemic is putting significant strain on paramedics and emergency medical technicians across the country.
I think the biggest hurdle during this time is basically just managing the team, because it's been unprecedented times. We've never handled such a massive, basically we've never handled a pandemic in this country.
Handling active and highly infectious COVID-19 patients is no doubt the most trying and difficult ventures that these paramedics go through on a daily. A slight mistake during donning or doffing may well turn tragic, not only for the paramedic, but also for their families, who they go back to after work, friends, colleagues, and generally people they come into contact with.
Initially, not so much was known about it, and when it actually presented first in the country, we can't say that we were actually fully prepared to deal with the disease.
E-Plus paramedics work in an environment considered highly risky. The emergency service provider ensures that its staff are tested every fortnight, with a home-based care and hospital care arranged whenever needed.
The first people who would establish this contact are the paramedics. and basically the ambulance crew. And what happens after they've established contact with the person, and you want to ensure that they are also not infected in any way.
To illustrate what happens in the case of a suspected and infectious COVID-19 patient, E+ demonstrate to us how a mobile COVID-19 isolation unit works when the emergency provider attends to a patient suspected to be COVID-19 positive, going by the symptoms they manifest. This unit costs not less than 5 million shillings. It is designed in a manner that completely separates an infectious patient, with the paramedics handling him or her.
Can you hear me?
Yes. The unit has its own ventilation system and serves as a protection layer between patients and the paramedics.
This is an isolation chamber. We use it to carry highly infectious patients. So at times you'd get COVID patients who are really critical. So to reduce the rate of infection and the rate of contact with you and the patient, this is what we use to transfer them from one point to another.
Working in this infectious setting has come with its fair share of challenges. Susan Ngonga, the managing director, says she has to ensure teamwork and coherence at work at all times to keep productivity level at high.
As much as they're professionals, they're humans at the end of the day. They deal with this situation differently.
It is not an easy ride for the paramedics, but nonetheless they have dedicated their lives as frontline workers to save lives. The emergency services offered by them is undeniably crucial, as they serve as a life-saving bridge between patients and urgent hospital care. The life of a paramedic is in a manner that they constantly have to be alert. Their role is now more pronounced during the pandemic, as their response could be the difference between life and death. Elfas Lagat, Citizen TV, Nairobi.